Hello, Austin. It's great to see you again. Could you please tell us a bit about yourself and why did you choose to teach anatomy?
Yeah, so my name's Austin Alexander. I'm an assistant professor of anatomy at Hardin-Simmons University and an adjunct instructor at Abilene Christian University, both located in Texas. I started probably my passion for anatomy through my undergraduate curriculum at the University of Oklahoma. I
Hmm.
kind of fell in love with anatomy, and I was blessed with the opportunity for completing cadaver dissection. Then after graduating, I pursued my clinical doctorate in physical therapy at Hardin-Simmons University, where I got to spend essentially a year and a half, three separate semesters, really diving into a lot of detail in anatomy and neuroanatomy. And since that time, I've continued to be passionate about anatomy as a clinical specialist in pediatric physical therapy. And then I had the opportunity to assist Hardin-Simmons University in their physician assistant program in teaching anatomy alongside a general surgeon. And since that time, I've transitioned to full-time teaching anatomy at the undergraduate level, and then the graduate level at the physician assistant program, occupational therapy program, doctor of physical therapy program, and even starting our family nurse practitioner program in Texas, one of the few schools that gives the opportunity to teach cadaver dissection, specializing specifically in that program.
Oh, wow, that's quite a lot of achievement. All right, that's great. What do you think are the challenges of teaching anatomy during a pandemic?
So I think right now it's kind of a buzz topic talking about COVID and the pandemic, but I would kind of zoom out a little farther and even say that this has been a challenge before the pandemic. I think some positives from the pandemic are allowing us to think about anatomy education in different ways. There's some research from 2021 that they found that utilizing looking at stress levels related to anatomy education and how some of these virtual dissections and online dissections can actually help decrease stress levels in anatomy education. So I think in my opinion, I think cadaver dissection will always be the gold standard in anatomy education, and COVID really kind of challenged us and we couldn't be in the lab. I mean, that's huge
Mhm.
and especially unexpected, meaning that we didn't have time to really make a plan for that to happen. So luckily, my integration with some of the virtual cadavers like 4D Anatomy, I mean, less than 24 hours, we transitioned to an online program where we did lecture-based instruction that was recorded through Zoom, but then also students had the benefit of having a virtual cadaver dissection, which obviously I would say it wasn't ideal in the given amount of time we had to prepare, but at the same time, I feel like we were able to address learning anatomy in the times given. Kind of had to adapt, and we were forced to. So on the positive side, I think that maybe opened some doors for looking at how we can integrate some of these virtual dissections and other teaching modalities to maybe enhance anatomy education that we haven't thought about or haven't been forced to think about previously.
So would you say that you are using these tools and methods to deal with these challenges at your university?
Oh, 100%. So I think going forward, even when COVID's, we get past this pandemic, I think looking at short videos for students to watch before getting into lab, utilizing, like I utilize an iPad when I'm teaching, and I can screen record, going through 4D anatomy and being able to show the students, okay, this is what I expect you to do before we even get into the cadaver lab. So now the beauty of 4D anatomy is, I mean, it's the embalmed cadaver that they're going to be seeing when they get in here. It's the exact view. It's not a textbook illustration. It's exactly what they're going to see. And that can help enhance these, making, even a short 2-minute video, then they have an idea of what they're going to see when they get into the lab.
That's great to hear. And do you have any advice for anatomy teachers facing the same challenges as you mentioned?
So I think the biggest challenge is there's so many things out there. it's hard to replace, and I would say it's almost impossible to replace the experience of the actual hands-on cadaver dissection. But I would also say that if you look at students, they're Googling and they're watching YouTube videos on the side. So if
Yeah.
we're, as educators, if we're not really strategically providing them resources and information to get high quality information, we're really doing a disservice, because they're going to be looking it up regardless of what you want. They're going to be trying to find short videos and different ways to look at resources based on their learning styles. So as educators, we need to be able to find multiple resources that we can provide to the students, especially based on the varying learning styles of each student, because each student's going to benefit from certain programs more so than others.
Agreed. And if you had to give advice to students who are studying anatomy and are struggling and facing difficulties during this pandemic, what would it be?
So if I had to give them a piece of advice, I think my biggest piece of advice is look at multiple modalities at the same image. If I'm trying to learn the biceps brachii, musculocutaneous nerve, looking at the textbook and expecting that I'm going to understand it and be able to relate it to clinical practice is, I mean, it's just not going to happen. So maybe looking at the textbook is a great start, understanding where it is, but then utilizing things like 4D anatomy, visualizing that 3D aspect, turning it around. Look at a posterior view, look proximal, distal, anterior views, lateral views, and then also look in the cadaver lab. So now not only am I looking at a textbook, I'm looking at a three-dimensional view, isolating that structure. I'm looking at the cadaver. I'm looking at multiple different locations. I think that can really enhance their understanding. But then also the biggest mistake I see students making is they'll study for lab, they'll study for a lab practical, and then they'll go study for the written exam. You got to break that. You have to study for the lab practical and the written exam in combination. So utilizing 4D anatomy, looking at if I have a brachial plexus injury to the musculocutaneous nerve during a neonate being delivered, well, then really following that nerve up to the nerve roots and understanding, okay, this is causing damage to the C5, 6, 7 nerve root, tracing it down to musculocutaneous brachialis and coracobrachialis. Okay, so that makes sense. These nerves are going to be impacted, and then thinking about their action, and then how's that arm going to be positioned in that waiter's tip position. I think you can't just identify the muscle or the nerve and stop there. You have to really think about how is it going to be applied and do all of that together.
That's a great advice. And I have to say, you started using 4D interactive anatomy way before the pandemic hit. So was it foresight or just pure luck? And why did you choose our platform?
So probably a combination of both. One thing that I'm really passionate about is I try and get student feedback, and I think student feedback is really important. And doing a student evaluation at the end of the semester where I can't impact students in the moment, I think does a huge disservice in education. So after each exam, I do exam reflections and I get student feedback, and it was commonly, almost majority of feedback is they want more videos, they're looking up YouTube videos. And I was somewhat frustrated in the fact that they're Googling all these random videos. Who knows what type of information they're getting? What could I do as an educator to put good resources in front of them that they could utilize? So that was one of the reasons I looked into virtual dissection. Another thing, in the state of Texas in the United States, undergraduate education isn't allowed to do cadaver dissection based on the legislation from the anatomical board. So that also got me thinking, looking at research and students that did undergraduate education, looking at models, looking at animal dissections. It didn't translate well to success in graduate level anatomy courses. So another thing that really drove me to 4D anatomy is it's the actual real cadaver that they're going to be able to see, and I want them to learn on a human body. I don't want them to learn about a cat or a dog or a pig. Not saying that that's not important, it's not valuable, but I would say that that's more should be targeted towards comparative anatomy and to translate to what they're going to see in graduate school. They really need to see the exact what it's going to look like in a human.
Agreed. And how do you use our platform in your classes? And how has been the students' response to the platform?
Yep. So I utilize it. We actually bought some TVs and mounted them, not in this lab,
Mhm.
but in the undergraduate lab. I mounted them on 60-inch televisions on wheels, and it has a keyboard. It's Wi-Fi enabled, so they can, just like a computer, they can log into any website. So they can pull up 4D anatomy right at their station. I still utilize anatomic models. So they'll have models at the table, and then they can pull up 4D anatomy, look at the model, get the actual touching feeling of the model, but also look up and see, oh wow, this looks a whole lot different on the actual cadaver than this model that's sitting in front of me. So helping them to translate that understanding with the model to, well, this is what it's actually going to look like, and be able to talk through things like anatomic variation that unfortunately just on a model you can't really truly appreciate or understand. And then you see right now I'm in the physician assistant program lab, our cadaver lab here at Hardin-Simmons, and I have 4D anatomy pulled up. We have, I don't know if you can see it here, but we have
Yeah, I can.
a projector screen in the back, and then we have two TVs on each side. In the doctor of physical therapy program, the lab's even bigger than this one, and we have a same setup, projector screen,
Mhm.
and I believe we have 4 large televisions on the side of the room. So not only can they be looking at the cadaver, they can look up and be like, well, I'm about to do this dissection. I don't really know what I'm looking for. Pull it up on 4D anatomy, see what it looks like. Okay, now go and do the dissection, and I know what I'm looking for before I ever even make that cut.
That's really great to see. And the students, are they pleased with the platform?
Yes, I think students love the visual representation that they can see something before. A lot of students are terrified that they're going to come in lab, even though we give them instruction that they're going to essentially be blindly cutting and they don't really know what they're doing and they think they're going to mess something up. Getting the actual image that they're going to be able to see what it's actually going to look like when they get to that level through the dissection, I think is very helpful. Textbooks do a great job, like Netter's illustrations obviously are excellent, but it's hard to really visualize what it's going to look like, and 4D anatomy gives them the opportunity to do that, um, that rotation of the structure and really try and grasp and understand that 3D perspective instead of just looking at a 2D image in a book.
So, well, what would you say that we should improve on our platform?
Things students love is like what I have pulled up right now. I don't know if you can tell, is the labeling tab. So if you go and click on
Mhm.
labeling, and then they can highlight over a structure, because a lot of times they're like, I have no idea exactly what I'm looking at, but then when they highlight over and it highlights green and tells them what it is, they find that very helpful and less stressful than trying to blindly search for a structure. So utilization of the highlighting feature and being able to, like right now I have the median nerve highlighted in the wrist and hand,
Mhm.
but if I were to go over there and click, and actually I can do it right now, if I go over and right here, if I grab that and then move it, now that highlighting goes away. So
Mhm.
I know that's a big probably technology ask to keep that highlighting there while they're rotating, but I think that would be
Mhm.
helpful for them to be able to visualize that structure while they're moving it all around. And because now I have to go back and I have to reset it and be able to view that. Um, Other things, I would say larger, like regional anatomy. Now, I think you're zoomed in, like here on the hand and wrist is excellent, but being
Mhm.
able to trace the brachial plexus on a regional approach, like the entire arm, being able to visualize it from the, I mean, ideally from the roots in the neck all the way down to the hand, and be able to trace things like the ulnar nerve, how it's wrapping around the medial epicondyle and visualizing that. I think that helps students a lot. If I zoom in, I start big and then I go into the detail of the cubital fossa. But I think you've already addressed this, but putting orientation tabs like what would be more proximal, distal, medial, lateral, that could potentially help and be an easier quick fix solution. But like y'all said, adding larger regional views like an entire upper extremity, I think would be incredibly helpful for the really a novice learner and learner that's just maybe one of their first anatomy courses to be able to
Mhm.
understand, okay, well, this is where it is in the neck, this is where it's in the arm, the cubital region, the forearm, and the hand, and I can see that all the way through.
Actually, yes, that is one of the very feedbacks that we always get about the labeling and the larger images, and it will be optimized. All right, so with the vaccination on the way, are you still planning to keep using 4D even after the pandemic is over?
You bet. So kind of how I touched on it earlier, even though the pandemic's here, we're getting back into the lab,
Mhm.
um, utilizing things like 4D anatomy. One thing I implemented this past semester, this past fall in 2020, was the option where I can download images directly from 4D. So I get an image right there and I can download it. And I actually embed it in our learning platform with Canvas, and I
Mhm.
create a quiz that's a lab assignment. So not only for that week do they come into lab, we have lecture, we have videos for them to watch, but then I created a quiz that is the image pops up and one of the structures is highlighted, and then they tell me, they just click what the structure is, and I give them the opportunity to take unlimited attempts on that, and they just have to at least score an 80% or higher to be so if they take it once, get an 80 and stop, that's great. Most of the students take it multiple times. It's pretty quick and short, but the students are getting more repetition with seeing the images of the cadaver, even when they're not in the cadaver lab, which that's what I think we have to move to. Students going home for the weekend to visit their parents, now with things like 4D anatomy, they can, I know it's not the same as the cadaver, but they still have the opportunity to learn and advance their knowledge, even when, if something comes up and they have to go home, they still have that opportunity.
Mhm. So, since the feedbacks to these virtual platforms have been really positive lately, do you think these tools should be implemented in the studies even after the restrictions are lifted and everything eventually goes back to normal? Students have access to labs again. So, do you think these tools should exist even after all this pandemic is over?
100%. So even if the cadaver lab's open, you have to look at undergraduate education. If you target that, most anatomy educations right now in the undergraduate level are not utilizing cadaver dissection. A cadaver lab is incredibly expensive for a startup cost if you don't already have that developed at your institution, and legal regulations associated with it. Because if we look straight at the literature, there's research out there showing that students really need 3 or more anatomy courses at the undergraduate level to make a significant impact on their anatomy course grades. So essentially, if they don't take 3 courses in anatomy, they're not, and cadaver dissection, they're in the same boat as someone that has 0 anatomy experience before they're coming into medical school. So to me personally, that's saying at the undergraduate level, we're doing a disservice to these students and not adequately preparing them for graduate level anatomy courses. Now, obviously, that's not true to every undergraduate anatomy course and program. Some, especially across the country, we have some amazing anatomy instructors and programs that are preparing these students well. And then in graduate level, other costs, I mean, right now, if we think about financial burdens at universities, budgets are going to be cut, left and right, if we're being honest. And utilizing things like 4D anatomy could potentially be a solution for certain programs across the world that could still be able to provide good anatomy education, even with financial constraints on their institution.
That's terrific to hear. Do you have any upcoming anatomy related projects?
So essentially, I always have a anatomy related project. I'm working on my PhD in anatomy and medical education at Eastern Virginia Medical School. So pretty much every day I'm working on that. But essentially every semester, fall, spring, and summer here at Hardin-Simmons University, I have some related anatomy course that we're working on, whether it be the physician assistant program, the physical therapy program, or our nursing program at Patty Hanks. Pretty much year round, we have anatomy going on. So I've been working on looking at internally, which some of this data I can't share, but internally I'm looking at surveys with our students and their perception of their undergraduate education and how that prepared them for anatomy, the graduate level anatomy programs. And that's really interesting to me. Other things I'm looking into is stress related to anatomy courses. And it's fascinating that utilization of some of these virtual cadavers and technology recently have found to decrease stress in anatomy courses, which I think could be huge for anatomy education at every level.
Mm-hmm. All right. Is there anything else you would like to share on this topic?
Nothing specific other than I think in anatomy education, we really need to focus on what about our student learners, and we need to think about their perspectives, not just our perspective as faculty members, and really try and create innovative, creative ideas and platforms that will be able to enhance their education regardless of some of our personal biases or inputs.
All right. Thank you, Austin. I think that would be all. It was great seeing you again, and hopefully we'll be in touch again.
All right, thank you very much.